Now, what the new research, particularly over the last 10 years, is about that beautiful dance between the genes that we inherited from our ancestors and the environments and experiences that we live in, both how we're fed, our physical environment, the nurturants that we receive, which creates that epigenetic story, which is how the environment influences our genes, turning them on and off to really create that developing brain. And 85% of the human brain is developed by the time the child graduates from kindergarten. And we know that early experiences that are nurturing and stimulating actually thicken the cortex of the child's brain. So it's creating a brain that has more extensive and sophisticated neuron structures. And it's how that brain is wired in early childhood, which will go on to influence our ability to learn, to get along with others, and even our physical and mental health. But we also know that if early experiences are dominated by fear and stress, particularly if these are prolonged and chronic, that it actually scrambles those neurotransmitters, and those then become the primary architects of the brain. And that trauma then plays a key role in how the brain is wired, actually affects IQ. And lower IQ in itself is a risk for factors that are associated with problem behavior and mental health issues. Adversity in childhood actually expresses itself very early. Those of you who work with young children know it expresses itself in aggression or withdrawal in preschoolers, but it begins also to show up quite early, so that by the second decade of life we're seeing school failure, early pregnancy, troubles with the justice system. By the third and fourth decade, early childhood experiences are associated with obesity, blood pressure, mental health issues. When we get into our fifth and sixth decade, we're getting into heart disease and diabetes. And by the time we're in our 70s, we're dealing with premature aging, dementia, those sorts of issues. Low literacy then travels with us throughout our lives, and also we have poor social and economic prospects in our life. And for those of you that work in health, which I understand some of you do, you know that all of these factors are what's really driving health costs. So part of maintaining a public health system in Canada is that prevention that we need to engage in the early years to ensure that, in fact, our healthcare system is sustainable. Now, the cost analysis, this is an analysis by the Canadian Council on Learning, and unfortunately that group isn't with us any longer, but one of their parting gifts was looking at what the annual cost of each cohort of school leavers are. So these are people that don't graduate from high school, and every year there are tens of thousands of young people that don't. And the cost is pegged at about, for the public, is pegged at about $75,000 a year each year. And that's a combination of the fact that these folks are less likely to get a job, so they're not paying income tax. They're also more likely to draw down on social services and unemployment insurance. And unfortunately, because there is a big link between low literacy and getting in trouble with the justice system, they're also more likely to be involved, that there's a public cost in terms of crime. The cost to the individual is even higher, and that's about $11,500 a year in lost income and health cost. 1 year, so if we just track that 1 year of school leavers over a lifetime, the lifetime cost is about $18 billion. So when we think of that, each year, that cohort goes on and creates those costs. So those are big numbers that we need to think about when we don't engage in prevention in the early years. There are several factors that influence outcomes for children, and most of these exist in the family. And there's a reason why we say that families are the most important for children, why parents are their children's, first teachers. It begins with the individual health of the child, the social economic status, the mom and dad's education, and we see here that moms are more influential than dads. And that's only because moms tend to spend more time with children in their early years than what dads do. Not true, of course, for any dads in this room, but just in general. Family income is also a factor. But when we look at the outside influences, those programs that make the biggest difference in achievement for kids lie in their preschool education and in their primary school education. And from a public policy perspective, it's very difficult to engage in these factors. I mean, those of you who work in family support programs know that it's very intensive. It's not that you can't make any changes, but really changing family dynamics is difficult from a public policy perspective to do. It's very intensive. We tend to do it family by family, and we really don't have those big population level health changes out of it. Where we do get population health changes is when we engage in good preschool and good primary education. This is a study which came out of the UK, and it looked at, and this is for all kids in the United Kingdom, and it looked at numeracy skills from the time the child turned 3 and tracked them through to age 6. And they were, and what they saw, so at the grade 3, at the age 3 assessments, children were found to be, below expectations, at expectations, or a little bit above expectations. Then they were tracked and they were assessed at kindergarten, at the end of grade 1, and again at grade 6. And what they found is that there's movement. Some kids started off well, they stayed well. Other kids started off well, their competencies dropped. Some kids started off below par, and then they moved up. But really the point of looking at this graph here is what you see. So where's all the movement in the graph? It's before children begin school. So if you really want to change those numeracy trajectories, and we could do the same thing if we were looking at vocabulary and other skills as well, competencies as well, if you want to change them, you really need to intervene before children start grade 1. So this is a population-wide wide study, and and we could look at these sorts of studies done on a smaller scale elsewhere, but it's pretty compelling findings. What the UK study also found is that it's not only attending an early education program, but the quality of that program and the duration of time, the amount of time the child attended. So what you see here are programs that were assessed as low quality, average, and high quality. And it's interesting to see that even low quality programs give children a developmental boost. And we think that this comes, or the researchers think this comes just by having children with other children. Children learn off one another, they're their own teachers. Obviously, the better the quality, the better the developmental outcomes. When you combine duration with quality, so at 5 years old, children are getting almost an 8-month developmental bump. So when you're 5 years old, an 8th-month bump is quite a bit. Then we have preschool quality and the link to self-regulation and pro-social behavior. And again, what you see is that in terms of the pro-social, quite a bump for it, whether or not the programs are low quality, medium, or high quality, but not that same results in terms of self-regulation. And what self-regulation is really how the child's lymphic system develops so that it's able to attend, to focus, to learn. And it really seems to be that quality becomes then very, very important. And often in the field is we find that self-regulation is interpreted as being behavior management. It's not behavior management. It's not about controlling the child's behavior, or even it's about helping the child to manage its own behavior. And children who are able to manage their own behavior are children who are able to attend and to learn.